We have an incredible opportunity here in Boulder County to continue to strengthen our safety net. Greater collaboration in the future with our various agencies will have an even more pronounced impact on our clients. For example, the patient who is trying to come into our doors but also has housing needs, that's preventing them from really perhaps excelling in their healthcare or really improving long-term in their healthcare. We see that within the homeless patients that we take care of and that we collaborate around in Boulder, for example. Similarly, if someone is working on access to food but has nutritional and dietary needs from a healthcare perspective that the food service agency may not be aware of, that collaboration again can really reinforce those messages to those patients. And again, I think for a lot of members of our community, that first step in accessing services in our community is a hard one. There are stigma, there are challenges to getting in the door. It's a scary prospect. Once you've gotten in that door, I think it's really our role and our ability through greater collaboration to open up the other doors for them. We've collaborated really closely with the Department of Housing and Human Services here in Boulder County, particularly as we've both ramped up to meet the needs and the demands of the Affordable Care Act and the Medicaid expansion here in the state. So, it's certainly in the interest of Clinica to help our patients, and particularly all of the uninsured patients that we've taken care of for many, many years, to get access to all of those different benefits that they're entitled to. Boulder County Housing and Human Services has a similar interest in really supporting that enrollment. And so Clinica and Boulder County Housing and Human Services collaborated from the very beginning to say this is a mutual interest. We both have staff, we both have resources to support this expansion. How can we do it with as little redundancy and as great a collaborative process as possible? We did that through data sharing. So Clinica collects a lot of information on our patients to understand their family size, their income levels, to try to be checking eligibility all the time. We have all of that electronically. Boulder County has great resources to do outreach in various ways to those patients. So not just when they walk into our doors, but outreaching to them across the community. So we were able to share that information in a secure manner and make sure that we were not repeating the same effort, but that we were really taking our resources and using them as best as possible. Collaboratively through that process, I'm pretty sure that Boulder County had the highest eligibility to enrollment ratio of any county here in Colorado, and that's, I think, a huge kudos to the County Housing and Human Services and a nod to that collaborative process that all of these social service agencies did to really make this effort a success.